It's pretty wild to think about how one single event can completely flip your understanding of something as basic as health, right? I mean, just a few years ago, a global crisis swept across the planet and basically forced us all to rewrite the rules. So today, we're going to break down how that massive wake-up call created a whole new field of medicine and what that really means for your future. Alright, so here is your game plan. We're going to start by looking at how things used to be, back when we thought health was pretty much a local issue. Then we'll get into the global wake-up call that changed. Well, everything after that's well nailed down, what global health actually is, break it down with a simple model called the 5 Ps, and wrap up by looking at why this is really the future of medicine. Okay, so let's set the scene by rewriting the clock just a little bit. Before this huge global event, the world saw health through a very different lens. For the longest time, the common thing was the health was a pretty contained local issue. What's really incredible is just how fast this all changed. Seriously, if you go back just one decade, the consensus was simple. A health problem in one country was the country's problem to solve. Period. Solve, period. But then, about 5 years ago, one local outbreak started a global change reaction, which brings us today, where we finally see health for what it is, this massive, interconnected global web. And this was pretty much the mindset everywhere. Health was what happened at your doctor's office or in your local hospital. Healthcare systems basically acted like their own separate islands, working almost completely independently from each other. The focus was all about treatment inside your borders. Well, that whole island mentally was about to get washed away by a global tidal wave. And I think you know what I'm talking about. The COVID-19 pandemic. This quote just nails it, doesn't it? Something that started small in one place just did stay there. It's proved in the mostly painful way possible that our world is way too connected for a local-only approach to health. The old way of thinking was officially shattered, and just look at that number, over 200 countries. That's basically the entire planet. This wasn't a regional issue, it was a human issue, and it proved beyond a shadow of doubt that health treat anywhere can become a health threat everywhere. And fast, and the impact was this devastating domino effect. Your healthcare system, which we thought were pretty solid, were pushed to the absolute brink. That led to shortages of critical supplies like ventilators, and that first shockwave the mess up with the all start of other essential service things like cancer treatments and routine checkups, and it wasn't just physical. We saw a huge toll on mental health, and maybe most importantly, it exposed the massive inequities in who could even get a life-saving vaccine. So this is really big takeaway. We saw a fundamental shift. Before, medicine was mostly about treating you after you got sick. Now we get that it was to depend just as much on prevention and strong public health. We went from a world where countries mostly acted alone to reality where working together. It's just a nice idea. It's absolutely essential for survival. Okay, so this crisis forced us to come up with a totally new way of thinking about health in this modern, super connected world. And that was framework it's called global health. So, what is global health exactly? Well, at its heart, it's about bringing people together from all kinds of different fields. Not just doctors, but economists, sociologists, engineers to take leads to huge goals. First, to improve health for everyone on the planet. And second, to close that massive gap in health between the rich and the poor. And that really gets to the core idea. The main objective here, health equality. This is such a powerful concept. It's the idea that every single person, no matter where they born or how much money they have, deserves fair shot at living to healthiest life they possibly can. It's about opportunity, really. But global health thinks even bigger than that. It also includes this idea of the planetary health. And this is so important because it recognizes as simple, profound truth: you can have healthy people on a sick planet. Your own personal health is completely tied to the health of your environment or ecosystems and your climate. And hey, this isn't just some abstract idea. We can draw very real, direct lines from environmental issue to human health problems. I mean, it's pretty obvious, right? Air pollution leads to respiratory diseases. Climate change is creating conditions that help infectious disease spread. And there's even growing evidence that losing biodiversity can increase your risk for things like cardiovascular disease. The two are completely intertwined. Okay, I know this is starting to sound pretty complicated. You've got social factors, environmental stuff, politics, all mixed together. So how do we even begin to wrap our heads around all of it? Well, luckily, there's a pretty simple framework that helps us see the big picture. Let's call it the 5 piece framework. And it's a great way to see how all these pieces fit. So you start with people. That's all this social stuff like poverty, educational levels, and nutrition. Then you have the planet, which is everything we just talked about with the environment. Now, those two things influence on societally priorities. The big health change they focus on, like pandemics. Based on those priorities, governments create policies, like rolling out a vocational vaccination program. And all of that leads to the final P, practices, which is actually hands-off medical care and prevention you get. So the really takeaway here is that health is anything but simple. It's this complex dance between your own biology and the world we live in, or your society or environment and your politics. You've got to look at all 5 of these pieces together to really understand what's going on. And that brings us to your final and probably most important point. Why doesn't any of this matter to you? Because look, this isn't just some academic concept. This is blueprint for the future of medicine for all of us. There's this one line from the research that just perfectly sums it all up. It says that global health isn't just the present of medicine, it's also its future. This way of thinking isn't a side especially anymore. It's becoming the core of how we approach a public health in this 21st century, and that future is going to be built of these 3 huge pillars. First, a massive focus on prevention so we can try to stop these crises before they even begin. Second, a deep really commitment to equite to make sure everyone can get the care they need. And finally, a new era of international cooperation, because if we've learned anything, is that we are without a doubt all in this together. So we learned some incredible tough lessons about just how connected your health really is. We have the framework now, we know the principles. But that leaves us with one last really big question to chew on. Knowing everything we know now, are we actually ready for whatever comes next?